How's it going, guys? We have a medium difficulty question for pathology, step 1. 29-year-old woman, 5-month history, mild wheezes on expiration, occasional dry cough, no past medical history, vitals normal. Serum alkaline phosphatase and hepatic ALT, AST are all mildly elevated. Chest x-ray shows mediastinal nodularity, okay? And then we've got this image here, which is showing us a granuloma. It's a non-caseated granuloma. It's a pass level image, okay? You need to know what a granuloma looks like. Don't have to fucking tell you, okay? So granuloma is going to be a collection of macrophages that coalesce and become a multinucleated giant cell collection, okay? And it's usually in the setting of idiopathic autoimmune disease like sarcoidosis, can be Crohn's disease. Those are two very high yield causes of non-caseating granulomas in USMLE. Caseating could be things like Bartonella henselae, TB, fungal infections, and diagnosis here is sarcoidosis. All right, now I made it a little bit more difficult than typical. All right, well, I didn't mention the buzzy bihilar lymphadenopathy. Well, I've seen NBME rate mediastinal nodularity. Holy shit. Okay, and then you say, well, what's going on with the increased ALP and hepatic transaminases? I've seen this on one of the NBME exams. Okay, this is how I learn about this stuff too. Okay, you see this for the first time, you're like, really? Why is that increased? Okay, it's not a big deal. You can get sarcoidosis is a multi-organ system autoimmune disease, so it can affect organs like the liver. It's not just the lungs. So you can have the liver where you can get hepatocellular damage. You can get bile ductual damage, causing sometimes increased direct bilirubin and ALP. Okay, so I've seen a question where these are elevated. So and they don't have to tell you it's an African-American woman, all right? It's just got a 29-year-old woman here. So non-caseating granuloma, it's composed of macrophages, all right? Histiocytes, another name for activated macrophages. Question asked, which thought most likely seen as patient? Let's top the answer choices. Choice A, constriction of terminal bronchioles, wrong fucking answer. So you say there's mild wheezes here, I know, but it's not asthma, okay? Now, they can be very tricky. They can give you a very similar question. They can say, there's a question on one of the NBMEs where they say like, 35-year-old African-American woman, they give you a big paragraph about how she has a dry cough. Sometimes you get cough variant asthma. It's important you know that. They say chest x-ray shows no abnormalities. The answer is asthma, not sarcoidosis. Okay, so here we have the bihilar lymphadenopathy, mediastinal nodularity on a chest x-ray. So this is not asthma, let alone the fact that it wouldn't explain our elevated lab values here. Wrong fucking answer. Choice B, hyperproliferation of plasma cells, wrong fucking answer. Versus multiple myeloma. Lately, I've made many clips on this. Okay, so multiple myeloma, it's a plasma cell neoplasm. So you're going to do serum protein electrophoresis as first step in diagnosis, showing an elevated kappa lambda light chain spike. Okay, it's an M protein spike. Obviously, and then I've talked about how you can go on and do bone marrow biopsy as confirmatory, showing greater than 10% plasma cells, things like Benz-Jones proteinuria, blood smear showing clock-face chromatin in the plasma cells, hypercalcemia, lytic lesions, rouleau formation, high ESR, even high MCV. Point is, wrong fucking answer. Choice C, increased hydroxylase activity, correct answer. So you need to know the non-caseating granulomas in sarcoidosis secrete 1-alpha hydroxylase, converts inactive 25D3 into active 125D3. Latter goes to small bowel, increases calcium absorption, causing hypercalcemia. Exceedingly high yield, exceedingly pass level. Just I said it's a medium difficulty question. It's a little bit difficult of a vignette with a bit nebulous of answer choices, okay? I've seen NBME write increased hydroxylase activity. It's that simple. So the non-caseating granulomas, the macrophages secrete this enzyme for whatever fucking reason. I agree it's weird, not our opinion. And that is our segue into choice D, which is the wrong fucking answer, which is increased serum parathyroid hormone. Well, it's actually suppressed. So they'll do that. They'll give you an easy vignette of sarcoidosis, an arrow question, and you're going to select up arrow 125D3, down arrow PTH. Because the high vitamin D causing increased calcium absorption from the small bowel, that's going to cause increased negative feedback. The calcium sensing receptors, the parathyroid glands, you're going to suppress your endogenous PTH. Increased serum parathyroid hormone? Wrong fucking answer. Choice E, increased read index, wrong fucking answer. First to chronic bronchitis, okay, so it's the ratio of the mucus layer of the airways to its entire thickness, classically greater than 50% with chronic bronchitis. So you have a shitload of mucus production, a lot of hypoxic vasoconstriction, pulmonary hypertension, cause cor pulmonale, right heart failure. Increased read index, wrong fucking answer. You know the deal. I'm just going to make more content. If you're looking to subscribe to my channel. Appreciate your time. That's it.